Thank you very much to Nadia and to everybody. I'm really thrilled and honoured to be here at Research Australia's Health and Medical Research Awards for 2017. To Research Australia, to the great Sir Gustav Nossel, and to Chris Chapman and to Nadia and all of the board members, you do an extraordinary job. In a previous life, I had responsibility for the environment. And with that responsibility came responsibility for the Bureau of Meteorology. And with that came the opportunity to name cyclones as they came along. Given that chance, I would declare a Cyclone Nadia in terms of recognising the incredible energy that she brings in her own right, but above all else, on behalf of and as an advocate for Research Australia and the extraordinary research community that's here this evening. And you look around this room and you see people such as Alan Finkel, Australia's Chief Scientist, Charlie Day, who's the new CEO of Innovation and Science Australia, Peter Wills, the Deputy Chair here at Research Australia and the head of the Biomedical Translation Fund, Christine Bennett, and so many others who have contributed to the development of medical research and the translation of medical research here in Australia. I'm not sure what the collective noun is for a group of researchers, but perhaps to take Nadia's theme, I look out at a galaxy of Australian medical researchers. I want to acknowledge my colleague, Senator Kim Carr, who's had a long and distinguished career in this space in particular and whose commitment is real and abiding. My state colleagues, Frank Maguire from the government and Mary Wooldridge from the opposition. Mary and I have known each other for nearly 30 years now, and just like Frank, this is one of her genuine and real passions. And also our philanthropists, and I know that Andrew and Nicola Forrest from the Minderoo Foundation are here today, and they have been very generous with their support for real and fundamental additions to research in Australia. So let me begin with an apology and an observation. The apology is that, unlike most of you, I'm not in black tie, but that may be because some years ago my staff indicated that there was an upcoming black tie function, and I indicated that I only ever wore, out of respect to my mother, who was a Grant and therefore a Scot, my kilt to black tie functions, so I only ever get told that the dress for events is lounge suit these days. Everybody thinks that's a good idea. But the observation is this, and it's to put medical research into a real-world context. 2 weeks ago, I had the honour and the privilege, but also the weight of visiting the Sydney Children's Hospital, and in particular the oncology ward. And I met 4 young children there who had been going through the Zero Childhood Cancer Initiative earliest stage program, which is about sequencing the DNA through biopsy of these children who are facing the hardest of journeys and trying to determine whether or not there is something unique which can be treated as part of precision medicine. And then, if so, if there is a particular treatment and cure which can be targeted for their personal needs. It's the work that Andrew and Nicola are pledged to through the Ending Childhood Initiative, but it's the work that the government is committed to, and everybody here. I met a little girl, Ellie. Ellie was 12 months old. She just had her first birthday in hospital. She had a tumour which had spread across her chest cavity. The picture on the X-ray was of a tumour that had started to press against the coronary area and had started to press in a very significant way against her lungs, and so much so that she'd had to go onto breathing apparatus, and the diagnosis had not been good. So she was one of the very first which had the DNA sequencing done under the under the Zero Childhood Cancer Initiative. It was a last shot. Her parents had been warned that it was time to prepare for the worst. And this beautiful little girl was struggling to breathe and struggling to get the full pumping of blood through the body. They found what was an exceptionally rare genetic condition, which had helped contribute to the circumstances, so a mutation. There are only a few dozen people around the world who fell into this, but because of exactly what Nadia was talking about, the ability to data match, they were able to find that there was one new drug being developed. It hadn't even reached anything like a phase 3 clinical trial. But by getting in contact with the company, there was a compassionate access that was given almost immediately, because this beautiful little girl only had a few more days or weeks at best. And this drug was air freighted out to Australia, and it was applied to her. And most interestingly, the girl that I met was 2 weeks after she had commenced the program. By this stage, she was off the ventilation, which was the program that everybody had thought would be a one-way journey. There had been a 90% reduction in the size of the tumour. She wasn't out of the woods yet, but because of the combination of medical research overseas where the drug had been developed, of medical research in Australia where the diagnostics were being done, of medical research at Sydney where they were working with the Garvan Institute on the sequencing of the DNA and the ability to find what was the root cause of the problem, something which was impossible not 10 years ago, not 5 years ago, not even a year ago, but 6 months ago, was able to have been achieved. And this young girl's parents sat there with tears streaming down their eyes and simply said thank you. And it wasn't to us. All thanks was due to the researchers and the clinicians who had given their young daughter a shot at life. So when we think about what medical research is about, it's about Ellie, it's about Abe, whom I met there that day. It's about Ava, whom I met, and so many others that we have seen along the way. That's why what you do doesn't just matter. It is the very essence of a meaningful life and a good society at its absolute best. So against that background, where are we in Australia? Where is our tradition in terms of how we stack up? And I think that we have a rightful claim to be one of the world's leading medical research nations, and we have the rightful ambition to be, pound for pound, the world's best and most advanced medical research nation over the course of the coming decade. We look at that history from Howard Florey to Macfarlane Burnett, and I see Sir Gustav over there who fits squarely and fairly within that tradition. And we come forward to the great Ian Fraser and to Elizabeth Blackburn, to Fiona Wood and Fiona Stanley, and all of those who are in this room now. And you think, well, how does this translate to people's lives? The work in translating penicillin, the work in terms of immunisation of the first two that I mentioned. But then you think, right now, as you work your way down the eastern seaboard, the nanopatch will transform thousands and hundreds of thousands, if not millions of lives, as the need for cold chain storage for vaccines evaporates in much of the developed world. We see Gardasil and the work of Ian Fraser and his extraordinary team saving hundreds of thousands of lives over the coming decades in terms of cervical cancer and human papilloma virus treatment. We see in Sydney a company that I visited, Saluda. Saluda is about electrical impulses which are implanted in the back to treat spinal conditions that most particularly deal with chronic crushing pain, where morphine wouldn't do the job, where other forms of treatment wouldn't do the job. An Australian breakthrough, which I think will go on, I hope, to be a $1 billion company. Just for the record, I have no investment, I'm not allowed to, but if I could, I would. But you then come down to Melbourne, Anatomics, which is leading the world in bespoke 3D printing for body parts, for replacements. And then only a little while ago, I had the great privilege of being at Walter and Eliza Hall Institute, where we announced the commercialisation agreement for Venetoclax. Venetoclax is an Australian invention, not 15 or 17 years in the making, but 30 years in the making, or an Australian discovery and development. And that discovery will help deal with leukemia and many other cancer indications as we go forward, and to give people a chance at survival who would never have had that before. So these are the great Australian achievements. And then we say, well, where does medical research fit in within our policy framework? So our policy framework is very clear. As Nadia says, we have a long-term national health plan built on guaranteeing access to our doctors and nurses and our new drugs through guaranteeing Medicare and the PBS, strengthening our hospitals, our public and our private, which also includes supporting our private health insurance as a fundamental guarantor of the first two, and then bringing, for the first time, mental health up to be one of the great pillars of the Australian long-term national health plan. And then the fourth, and perhaps in many ways one of the most fundamental of those, is medical research. And for us, medical research is about the great NH and MRC and the reforms which we've just introduced with Anne Kelso. And that's a $900 million a year investment all up, of which $800 million goes out in grants, as you well know and live, and I apologise for the paperwork involved. We are simplifying it. But then there is, at the other end of the spectrum, at the full translational end, the Biomedical Translational Fund. We've just announced 4 new programs, or 4 new grants, the first 4 grants under that. And these include, for example, robotics, to allow people who have paraplegia or quadriplegia to gain new movement. An Australian invention that will allow people to regain their lives, to regain their movement. And what a gift to future generations as that evolves. And there is chronic pain treatment for those, this is different from Saluda, who would otherwise have a daily living agony. And that prospect of transforming their lives through a $500 million program, half government, half private sector, with a return on investment, is something I think that we should all be proud of. And in the middle, to bridge that gap from the development to the translation, is the Medical Research Future Fund. And the 4 themes which I've talked about publicly previously and which we're working on start with patients and the focus on rare cancers and rare diseases and unmet clinical trial needs. That program has already opened and is due to close for first round applicants this week. And the latest advice I have is that there are more than 100 different applicants under that program. And so that will, I hope and I believe, expand significantly further under the Medical Research Future Fund and become a permanent part of what we do. Secondly, we have the support for our researchers, clinical fellowships, and then long-term programs, researcher-driven programs of 1 and 5 years potentially. Thirdly, national missions, which we'll outline in more detail going forward, including Aboriginal health, brain cancer, and long-term genomic futures for Australia, where the precision medicine, the personalised medicine, will change and transform lives. And lastly, translation, not just of individual discoveries, but also of the health system. So that's the framework. It's our job to support you. It's the philanthropist's job, where it's not their duty, they have no duty, it's their benevolence and their gifts in doing that. And you are the researchers that deliver. We are the ones that support, but at the end of the day, you are the ones that help Ellie and Ava and all these other beautiful children that we've met along the way have an opportunity for life. There could be nothing more important. I thank you, I honour you, and I wish you well for this evening.